The word pneumonia carries a heavy sound, but its roots are ancient, shaped thousands of years ago. It comes from the Greek word pneumon, meaning lung. In ancient times, healers knew little about the mysterious illness that suddenly made breathing difficult. They observed that people who once walked with strength could suddenly gasp for air, as if the sky had turned into water. They named it based on the organ it attacked, unaware that bacteria, viruses, and other tiny invaders were behind the suffering. Yet even back then, they knew one truth. Pneumonia was serious, and it could strike anyone. The story of pneumonia weaves through history like a shadow. It existed long before modern medicine, silently claiming lives in ancient Egypt, Greece, India, and China. Hippocrates wrote about it as a lung inflammation that came with fever, chest pain, and suffocating breath. People feared it because it appeared suddenly, especially in cold seasons, and its symptoms grew fast. In villages, towns, and armies, pneumonia was a hidden enemy. Before antibiotics, it was often called the captain of the men of death. But the world changed with scientific discovery. In 1881, scientists began to understand that pneumonia was not one disease, but many forms caused by bacteria, viruses, fungi, or complications of other illnesses. Streptococcus, pneumonia, influenza virus, RSV, and many other pathogens turned out to be behind the lung infection. Robert Koch, Louis Pasteur, and other pioneers helped uncover these invisible attackers, opening the door to prevention and treatment. Pneumonia usually begins when germs enter the lungs. They settle in the air sac-stany balloons where oxygen enters the blood. Instead of filling with air, these sacs fill with fluid and pus, making breathing difficult. A person may start with a simple cold or mild fever, but soon the cough deepens, the chest feels heavy, and each breath becomes an effort. The body fights back with fever, chills, fatigue, and chest pain that worsens when breathing. In children and elderly people, symptoms appear fast breathing, bluish lips, refusal to eat, weakness, or confusion. It is a frightening illness, but understanding it gives power. Today, we know that age plays a huge role. Newborn babies, young children, and elderly adults have weaker immune systems, making them more vulnerable. Gender also shows differences. Men often get pneumonia more frequently because of smoking, occupational exposure, and late medical care. Region matters. Two people living in cold climates, polluted cities, crowded houses, or low-resource areas face higher risks. Some regions still struggle with limited access to healthcare, clean water, and vaccination, making pneumonia more common during winters, rainy seasons, and outbreaks. Pneumonia does not always come alone. It often follows other diseases. People with heart disease, asthma, diabetes, HIV, kidney failure, malnutrition, or long-term smoking habits are more likely to develop severe symptoms. Respiratory viruses like influenza or COVID-19 can weaken the lungs and open the door for bacterial pneumonia. Even stomach acid entering the lungs during unconsciousness can cause aspiration pneumonia. Every factor shapes how strong the disease will be and how fast treatment must begin. When symptoms begin, early diagnosis is the key to saving lives. A doctor listens with a stethoscope and hears crackling sounds in the lungs. Chest X-rays show white patches where fluid has collected. Blood tests, sputum tests, and oxygen levels reveal the severity. Today, advanced tools like rapid antigen tests, PCR, and digital X-ray systems help diagnose pneumonia more quickly, even in remote areas. Treatment depends on the cause. Bacterial pneumonia requires antibiotics, and modern medicine has powerful ones like amoxicillin, azithromycin, ceftriaxone, levofloxacin, and others. Viral pneumonia may need antivirals, rest, fluids, and oxygen support. Severe cases require hospital care, oxygen therapy, or ventilator support. A patient may start with a burning fever and difficulty breathing, but with timely treatment, their lungs begin to clear, and each breath becomes easier. It is a slow battle, but victory is possible. Prevention, however, is the truest shield. Good nutrition strengthens immunity. Clean water and hygiene keep infections away. Warm clothing in winter protects the chest. Avoiding smoking and pollution reduces lung damage. Vaccination is one of the strongest weapons. The pneumococcal vaccine, influenza vaccine, Hib vaccine, and COVID-19 vaccines have together saved millions of people worldwide. Children, elderly people, pregnant women, and those with chronic diseases benefit the most from these vaccines. Many parents do not realize that a simple vaccine can protect their children from one of the world's most dangerous infections. Food also plays a vital role in healing and prevention. A body that is nourished fights diseases better. Protein-rich foods like eggs, chicken, fish, beans, and milk help repair the lungs. Fruits like oranges, apples, bananas, and berries supply vitamins to rebuild strength. Vegetables like spinach, carrots, broccoli, and tomatoes are filled with antioxidants that help the immune system recover faster. Drinking warm soups, herbal teas, and plenty of water keeps the body hydrated and eases cough and fever. Even simple home remedies like honey, ginger tea, and steam inhalation offer comfort, though they cannot replace medical treatment. Around the world, organizations like the World Health Organization, who play a major role in fighting pneumonia, who creates global vaccination programs, supports developing countries with medical supplies, trains health workers, spreads awareness, and helps improve early detection. They support campaigns like Stop Pneumonia, focusing on children under 5, the group most affected globally. WHO also guides hospitals during outbreaks, helping countries prepare for influenza seasons, RSV surges, and post-COVID respiratory dangers. Their work ensures that even the poorest regions can receive life-saving care. Despite all these advancements, pneumonia remains one of the most common causes of hospital visits each year. But the good news is clear. Deaths have dropped significantly in the last decades due to vaccines, antibiotics, early diagnosis, and improved healthcare. Modern machines help doctors detect lung issues faster. Portable X-rays help in villages. New antibiotics and inhalation therapies give hope where old medicines failed. Scientists are working on new vaccines to cover more types of bacteria. Digital monitoring apps remind patients to take medicines on time. Each step brings the world closer to defeating pneumonia completely. To understand its emotional journey, imagine a woman named Sarah. She is a school teacher living in a cold region, beloved by her students for her kindness. One winter morning, she wakes up with a cough. She thinks it is just a cold, so she goes to work. But as the hours pass, her cough deepens. Walking up the stairs makes her breathless. By evening, she has a fever and chest pain. Her family urges her to rest, but she keeps delaying. Days pass, and she becomes too weak to get out of bed. When she finally visits a doctor, they diagnose her with pneumonia. Fear grips her heart. She has heard frightening stories and worries for her family. But the doctor assures her that she came in time and treatment will help her recover fully. They begin antibiotics, warm fluids, inhalation therapy, and oxygen support. Her mother prepares nourishing soups. Her students send kind messages, and her community supports her with prayers and encouragement. The first few days are difficult, but slowly she feels the strength returning to her chest. Breathing becomes easier. She sleeps better. Her fever fades. Her lungs begin to clear. Within weeks, she is able to walk outside again, feeling sunlight on her face with gratitude she never felt before. When she returns to school, she shares her experience with her students, teaching them the importance of early care, vaccination, and kindness. Stories like Sarah's happen every day in families around the world. Pneumonia may strike suddenly, but recovery is always possible when knowledge, courage, and medical care come together. It teaches people the value of health, the importance of prevention, and the beauty of community support. And so the story of pneumonia continues not as a tale of fear, but as a journey of hope. We have the power to defeat it with science, awareness, nutrition, vaccination, and timely treatment. Each child vaccinated, Each smoker who quits, each home warmed in winter, each doctor properly trained, each family educated, these steps take humanity closer to victory. Pneumonia may be one of the world's oldest diseases, but modern medicine has turned the tide. What once threatened millions now meets powerful resistance from knowledge and progress. The world today stands stronger than ever, united through global health programs, scientific innovation, and human resilience. And as long as people keep learning, caring, and protecting one another, the end of pneumonia's shadow grows nearer every day. It began with fear, but it can end with hope. And hope, when shared, becomes the strongest medicine of all.